Hi, I'm Dr. Abdul Rahman. I'm a medical director at Dunia Clinic. It is a private clinic located here in Skyway, South Seattle. I've been in the medical field for over 20 years, and currently I'm doing a vaccine drive, or vaccine pop-up clinic. I have been doing the vaccine for over a year and a half now, since when it started back in last January, last year. How I get into the medicine, when I was born with something called rickets, the medical term called rickets. Other people call bow leg, but mine was really severely bowed. And my parents think I should go get straightened up a little bit because the doctor told me that if I don't do anything, it will cause a little bit more complication to my spine and my hips. So we end up having to do two surgery for each knee to try to straighten up the legs. But the place I was born, because I was born and raised in Tanzania. So usually the lack of medical facility, lack of medical care, but they ended up doing it, the surgery, but it was a little bit more brutal because we didn't have a regular surgery that you do over here. You get the anesthesia or pain medicine. I didn't have to do all that, so I have to go raw. And imagine I was only 8 years old. So I think that's why it got me into medicine, and I think that was the main purpose for me to do something to the community, and that's why I decided to do that. So since then, I came here back in 1998 in Seattle. I've been here in Seattle since then. I went to Bellevue Community College, and I went to University of Washington, and I worked at the University of Washington for about 7 years and went back to school. And after that, I worked for another company to be some type of provider that you go to the community and take care of people who cannot come to the facility. But also I thought that was still the need for me to do something because I was receiving a lot of phone calls to my people, the community, other people want some type of medical advice or medication to be refilled or something. Then I thought maybe I should do something to myself. And that's why in 2019, I decided to open my own practice. And since then, I've been there running my own clinic. Hi again, this is Dr. Abdul. I'm here with the Community Conversation, and we talk about COVID.
I'm Jada Morgan. I am a member of the Central District community. I've been working in there for a while, and I'm mostly here to talk about kids and COVID. So my first question is, would you give a child under the age of 5 a booster shot? Would you suggest that they get vaccines? What is it that you would do for kids under the age of 5?
Good question. The age of 5 is still in the process of getting approved by FDA. Has not been official. Okay. I believe it should be coming up. We just have received an email from Department of Health that we should get ready to start giving the vaccine to the children of 5. Okay. I personally, I have a 2-year-old, 2.5, and then I also have 3.5. I can't wait to give it to them. Yeah. Keep in mind that I'm always out in the community. Okay. I want to make sure that they are protected. Yeah. I do believe that they should be receiving because we start seeing a lot of cases also with the kids now. Before we didn't see that before. So I think to answer your question, I would give it to vaccine to kids under the age of 5, but with the guidance of the CDC and the DOH.
Okay. So then my next question would be, so for kids, for instance, who have immunocompromises, like cancer or just, there's kids now that, celiac disease, et cetera, lower immunity. would you say that with the vaccine for kids, with it being available and being ready to do it, would you still suggest that kids who are immunocompromised be around kids who are vaccinated, or do you think that we should keep them a little bit more separated? If a kid with immunocompromise is around kids who are vaccinated and one of those kids gets it, should you still keep them separate? Do you think that that would do something to minimize the effect for kids who are immunocompromised?
I think a lot of time people misrepresent about the vaccine and they feel like they're all full protected.
Yeah, okay.
But there's a chance that people can get infected. It's not a disease, but you can still get infected. So we're still going to have to still doing the masking, social distance.
Yeah.
We still have to do the same precaution that we're still doing it. And if we have been doing all these years, all this time that with this pandemic, I think we still continue doing that. And if we're still doing that, they all should be still safe to be around there.
Okay.
I believe if they do get the vaccine, it will give them a little bit of immunity to fight. It give them a little bit, some kind of cushion to prevent them from severely having disease.
Spreading it.
I would say disease because if they already have immunocompromised, they have a chances for them to get severe disease and hospitalized or death.
Exactly.
But if they get vaccinated or if we use all these precautions, then the chances there will be only infectious, which is different than disease.
A pandemic.
Yeah,
That makes sense. Okay. As someone who works with small kids, I'm tracking their developmental processes throughout the day. But if a kid's getting a vaccine, how do you think we should go about keeping the effects of a vaccine versus developmentally? How are we supposed to keep those two things separate while we don't have as much information about the vaccines in kids?
Okay. That's a very good question. But the vaccine is not a new to our society. There's people still hesitate for that reason because they don't know what's the long-term effect of the vaccine.
Okay.
But what we know, the vaccine are very safe, right? They're not just come out to the community, or they're not just given to everybody. They have to undergo a lot of phases, and they have to make sure they approve the vaccine are approved to be safe first. That's the number one.
Yeah.
The second one is it effective? Means is it gonna do what it's supposed to do? Okay. So they're not gonna just release those vaccines if they're not safe and they're not effective. Okay. But to answer your question about how can you track them, the CDC has the website to track as a medical provider. We do have the way after we give vaccine, we do give information to either parents or the parents can call the medical provider and let them know what they experience to the child. If there's any changes, we still upload it to the website. I think it calls a VARS, is a vaccine, some type of side effect.
Yeah.
And then everybody who get the vaccine, they do get some type of information shows that after you get vaccinated, because you don't know, you might not get the symptoms or any type of side effect in 15 minutes when somebody watch you.
Right, okay.
But then after you go home, something that might come up. So, but we still want you to report that. And those data still be collected to the CDC, and then also be able to update it, update it to medical provider, also to the community, to let them know what vaccines is safe or not safe. Okay. To monitor kids, again, this is a little tough one, you know? Yeah. It's not an easy one to say, yeah, it's safe, you're a parent. And some parents don't want to do it for the different reason. Yeah. But to me, it's very important to make sure that you vaccinated your kids, because the more we do that, it will prevent more infectious, it will give us more opportunity to go back to our daily life. Okay. Right? Yeah. So.
All right. Thank you.
Thanks so much. Appreciate your time and your questions. Hi, it's Dr. Abdul again, and we have another community member here with additional questions.
Yes, hello. Thank you, Dr. Abdul, for joining us today. I've got a full preparation of questions for you. We're going to
Okay.
talk about boosters.
Great.
So I am Jessie, and I am Filipino, born in Inglewood. However, living in Pioneer Square now. Yes. So
Great.
going into the questions, why would you suggest the booster?
Great question. Why we suggest a booster? What we know right now, based on the study, the vaccines do decline. The efficacy of the vaccine do decline over time, and so we think if the efficacy if it's declined, so I think to give a booster is to kind of re-boost your immunity in order for you to be up to date, right? There's another word you can use is to be up to date versus just a booster, right? Because if we don't get booster, if the immune decline, then we're going back to the same kind of wave. Because what happened if your immune is not strong enough, then you can start to spread the virus again, and everybody start to get sick again, and then that's how the spiral started, right? But when you get booster, it gives us our immunity a little bit enough time to work whenever we get exposed to the virus, right? So I think, in another word, in the best way to say or to answer you the best way without using all scientific terms, we say our immunity will decline, over time. So the efficacy of the vaccine will decline over time. So getting a booster kind of like bring it back to up to date, and that's very important. If we don't have a booster, then we go back to the same way of getting infectious, getting disease, going back to the hospital, death, and all this stuff. So that we don't want to go back to the same way, and that's why the scientists they recommend for us to go to get booster. But how soon, how many times we get booster, we don't know yet. It's still new information.
Okay. I have family members who continue to ask me why vaccinated people are still getting COVID, and that is one of the questions that are being asked quite often.
Thanks so much for your question, and I think that's the main concern to a lot of people. And I think is to clear to a lot of people about the vaccine is not intended to when you get vaccine is not intended for you not to get an infection, right? Because the vaccine is supposed to be when you get the vaccine is to prevent from severe disease, and then also the vaccine is supposed to prevent from death that causing from the disease. And that's the main purpose of the vaccine, because the way that people look at is there's two ways, right? You can get immunity. You can get immunity either by natural immunity, that you get COVID naturally, or you can get vaccinated, right? But the way I can explain to you, when you get natural COVID, means your body has no time, right? Have no time to adapt or to build the immunity. So you can get really sick, right? You can get really sick, or you not only sick, you can be hospitalized. It can be a complication from the disease or the vaccine, the disease that you get. But if you do get vaccinated, you have a chance to be introduced a little bit, like it's just a little tiny amount of the protein that introduced to your system, to your body, that is not replicating, like versus when you have the live virus. The live virus can be replicating fast, and that's why you get sicker, and also can get disease, means pneumonia. You can get any other complication related to the COVID. But when you get the vaccine, it's a really tiny protein that introduced to your system to allow your body to build the same immune system. But then you kind of like prevented from getting sick. But also, you can tell your family member that the vaccine is not supposed to prevent, like you are not living in a bubble. Like you can't get in. You can't even if you get vaccine, you're not supposed to get infection. Right? You're not supposed to get COVID. In other words, but it's supposed to protect you from severe disease, and complication, hospitalization, and death. And that's what we're trying to do. And that's the main focus. And a lot of people kind of misunderstanding about those two. They kind of mix together. I have vaccine, now I shouldn't get COVID. And that's not the case, right? You can get infectious, but not disease, you see?
Right. So it's like looking out for not just yourself, but other people as well. And
Correct.
I think we were speaking earlier about people who are already autoimmune compromised and how it really is being there for your community and your village of people. And I think that that's great that you shared that because not a lot of people do know that.
I like that, how you wrap it up. Thank you.
Yeah, absolutely. So I would say that I believe I know a bit about hybrid immunity, and I was recently vaccinated and also made the choice, to get vaccinated and possibly get the booster. I do have my concerns. If I had COVID and I didn't have any severe complications, do I still need the booster?
Yes, you do need your booster. And like I say earlier during this conversation, the reason you need to have a booster because first of all, the virus do mutate it over time. Like you say, we have a Delta, we have Omicron. Also, what we know from the data that coming in right now, we see that the vaccine efficacy do decline over time. They don't know why. And that's why I remember when we start doing the vaccine back in I believe it was around July when I was doing vaccine back in July. And I think one of the patients did ask me, are we gonna get another vaccine soon? And I said, oh no, I don't think so. I don't believe that. We already got the first and second. I don't believe there's one. And before that, we just find out that, oh, we need another booster. Not only booster, we find out that the people who have been vaccinated or people who had coronavirus infections, their immunity do decline over time. I believe also we have another example. I would say when there's one client who was traveling to Jerusalem, and they told me that she has to. We have to test the antibody level before she gets to Jerusalem. If the antibody level was below 700, she has to be quarantined or be tested when she arrived to Jerusalem. So I didn't know all this information keeps changing all the time. But to answer your question, and those are kind of things that we hear a story or we see the changing of recommendation because things do change over time because there's a lot of surprises that are coming, and in another word, nobody's expert in this coronavirus pandemic because things that keep changing, right? And then also it creates a little bit confusion to the community, to the people, and also it creates some type of hesitation more because you guys don't know, but it's not like that. It is great information to keep us up to date, to keep us more not only up to date, but to keep us more safe to our community. So to go back to your question, I do believe you should get a booster, even though you got you got both of your shot, right? Got first and second, and also you say you got infected.
Yes.
Okay. Yeah, but you still have to get your booster because the reason what I explained to you that the immunity and the efficacy of those vaccines do decline over time. So we need to be up to date in order for us to be safe to our community and also the people that you are around, your family members.
That's actually a term that has been thrown around a lot, like up to date and vaccinated, or I'm fully vaccinated, and it's like, which one is which, and am I up to date? Talking about the antibody test, should I get that done before I get the booster?
That question to me is very personal. Like you have, because I don't. What would be the reason for you to be tested for antibody to see your level? We don't know what the level of the antibody is still safe for you, but there's no threshold. The number that I throw out there, we don't know what the people from Jerusalem came back with that number. I don't know why they put 700. Um, you can still do the antibody, but I don't. I think to answer your question, the best way I would say there's no need to test for antibody in order for you to get a booster. I think it would be just better to just get the booster because the antibody might not mean anything at this point. We don't know the level of antibody at this point to say this is safe enough or this is not safe enough. But we know if you get a booster, it does bring you back to up to date. Right?
Perfect.
Yeah.
Thank you. I think
Yeah.
you answered all of my questions thoroughly.
Thank you, thank you. I tried. Hi, I'm Dr. Abdul again. We're here with the community conversation. I have another community member with the questions. So here.
Hi, my name is Ade Terry. I'm from Seattle, Washington. I currently live in Pioneer Square, and I'm excited to be here to ask Dr. Abdul a couple questions. My first question, I've heard a few things about side effects from the booster, one being heart inflammation. Is there anything we should know about that? How to maybe avoid side effects? Is that possible? What do you have to say about that?
Good question. The inflammation. So we have to look at the risk factor, right? So the risk factor from getting COVID versus the inflammation of the heart, which is myocarditis. Um, Myocarditis is a very minor, very mild condition that can be easily treated with medication. It's not that severe, and the cases are not very many. Maybe it'll be maybe 1% or maybe less than 1%. And mostly for men, what we know from the study, mostly young boys, like young boys, they do have this myocarditis. But like I said, every time when you go in the medicine, you look at the risk factor versus the benefit, right? The benefit and risk factor. So getting COVID minimize the myocarditis. Anybody would say, I'd rather just myocarditis more than getting COVID because the complication we don't know from the COVID, right? Where you're gonna go in a hospitalized, ventilator, pneumonia, and all the stuff versus just the myocarditis. Myocarditis sounds a really big thing, but it can be easily treated with just medication, just a few days at home. That's it. It's not a big deal. So I would say vaccinated. No worry about the myocarditis. Of course, we have to take a precaution, and that's what we all do. When they come to getting vaccine, the first time we do screening them and see what the potential the patient or somebody who might bring it after they get vaccinated. But from this situation, from this to keep our community safe, I think vaccinated would be more safer than what about the side effect that we don't know for sure if we have.
That makes sense.
Yeah.
So what about somebody who, they take the vitamins, they have their water, all the water that you drink every day, and they feel like, you know what, I can take on this virus. I don't need a vaccine, and maybe they're a little bit more afraid of the vaccine and the side effects and not knowing, enough about it. Maybe they're more afraid of the vaccine than actually getting the virus. What would you say to someone like that?
I think it's good to look at the community because you could be fine. Like I said, majority of the adults like you, young men, they have pretty good immune system. They're healthy. They shouldn't be worried about anything. But think about the people that you're gonna be around with, right? There could be people from your family member who's have diabetes, have other complications that you might not even know. But those are the ones you can give it to the virus. You give it to the virus, and that can cause complication to them. So, if we want to be all together and all about community, I think you should take that first step, protecting not just you, but protecting the people around you. It could be your family member, friends, and that's what it is. And sometimes you hang up with your friends, you say, "Oh, we're all good over here, we're healthy," but then they go home, they have their brother, they have their mother who have some complication that you don't know about. So that's why we try to be all together, so not to be isolated cases. So we want to do all together because it does affect all of us at the end, right?
Yeah. So you would give the vaccine to your mom?
Most definitely. I would give the vaccine to my mom. Unfortunately, my mom is not here in Seattle, but she's in Africa. I have I have tried so many times before. She's been hesitate in the beginning, but I talked to her about getting. She finally got one, so I'm so happy she did one. And I don't know if I would give vaccine to anybody that close to me, and I've been giving vaccine to anybody who's not close to me, and I know it's very important.
Right on. All right. Thank you.
Yeah. I just want to side note about the vaccine, about my mom. I give vaccine to my child, by 8 years old, right after when it came out. I give it to her the second day, I believe.
Oh, wow.
I give a vaccine to my wife. I get myself vaccine. And I think I just want to add on about this is since this pandemic started a year before, and that was the same time that I opened my practice, I kept my door open, and I've seen people from adult family home, the whole house wiped out, right? I go there because the DSHS require the adult family home to be tested to have two negative tests before they could be clear. On that time, I was going there and tested. I tested maybe the whole house, maybe 5 people tested positive. Wait for 10 days or 14 days. Going back, 3 people already dead back then, before the vaccination. And you just see case after case. So I don't see the cases for younger people, but I was seeing cases for these elderly people, and that's why somebody asked grandma. And then after the vaccine got introduced, that's why I start to see the difference. Because now I see when we go tested somehow, somebody let's say they're positive. Maybe the house, somebody had fever. They went to the emergency room, they test positive. Now the whole house is required to be tested, right? So I go there, tested, maybe 5 people positive again, but you going back again in 10 days, nobody dead, right? So I do see the difference between vaccinated and non-vaccinated, and especially for the elderly people. And a lot of time people thinking like if I'm healthy, I'm good. But think about other people who are not very healthy, and that's why you can transmit that virus to them. And then that's the complication comes down to. So I want you to take that message and give it to everybody and tell them they need to be vaccinated. Not only about them, it's about the whole community and all about not only them, about us, right?
Yeah, it's about us. Yeah. And you feel the same way about the booster?
Yeah.
Yeah.
Same way about booster, to get boosted,
Yeah, to get boosted.
to be up to date.
Yeah, up to date. I think that's it, right? That's the terms. Terms all
Yeah,
over the
because
place,
the
so
booster keep changing now. Now there's
Yeah.
a fourth one, right? You know that there's a fourth booster
I didn't know there were
now.
4.
Yeah, there's a fourth boosters for people who are immunocompromised. So now they consider 3 shot as normal shot. The fourth one is considered a booster now.
Mm-hmm.
So where is a booster now? You say, are you up to date with your
date.
vaccine? And that's the answer should be, right? Yeah, I do believe that vaccine, especially this one. I don't know, people, they still kind of like, what do you call it? Amnesia?
Amnesia?
Because we remember back in 2020, the whole country was shut down. We're expecting that after if we get vaccine, everybody will go out and get vaccinated, right? And then like everybody say, I don't want to get vaccinated now.
Yeah.
It just don't make no sense to me. But I wish people understood that it is important to be vaccinated, and vaccine is very safe too, to my opinion.
Yeah.
Yeah, it is vaccine is safe, and I got one, and I will give it to my mom. My mom got it. I give it to my daughter. I give it to my friends, and I'm still doing the vaccine. So anybody who wants to be vaccinated, I'm still doing it anytime.
Right on. Right on. Well, thank you.
Yeah, anytime. Hi, this is Dr. Abdul again. Thank you for joining us. We will be back here on February 21st at Boona here in Renton. So we'll be providing vaccine to kids, adult boosters. Also, we'll be doing the testing. Please come join us. Thank you so much for joining us. Thank you.